Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. If you've ever woken up with a crooked back, maybe you look like this, you've just thrown your back out, you're all lopsided, right? Kind of slightly bent forward and a little bit to the one side when you look in the mirror, then you've probably tried lots of different things to improve it. It's a very painful position to be stuck in. So if you look elsewhere on YouTube, they'll show you a shift correction because that's kind of what it's called. When you're crooked, you have what we call a lateral shift. It usually means that it's due to a disc problem, but there are other causes. So by the way, if you're not sure, check out my DIY diagnostic guide. I lay out exactly kind of how to figure out what could be going on. That being said, this lady back here, my wife, is doing what most people would recommend. And in fact, in an old video of mine, I show you the same maneuver, and this is called a shift correction. So if she was tilted one way, well, she would essentially be trying to push her hips back to center. And it would look something like this. Now, you can tell she's not really in pain because she has a smile on her face. Most people, when they do this, it'll be very painful. And in fact, they'll probably be crying. I've had some people cry when we do this, and I just don't care to put people in that position anymore. So if you've tried this shift correction and it's super painful, then I want to share with you in this video a few easier, more pain-free, just simpler ways to go about correcting a shift. It doesn't have to be hard, it doesn't have to be painful, and there are just easier ways to go about doing it. All right, so if you have a crooked back, then the first thing you'll most likely notice is that trying to stand up and walk around is super painful. And it's super painful because, well, you have to walk crooked because if you stand up and you try to bend backwards, you increase the pressure in the area that's injured, and it often causes pain, numbness, tingling, zapping down the legs. So that being said, most people, again, who are in that crooked position will find that walking or being upright is painful, but they actually feel better. And this is the weird thing. Like, Dr. Charlie, if you're saying the most common cause of a crooked back is a disc issue, then I thought disc issues like to be standing up and like to do all this backwards motion. Not in this case. In fact, you're really going to like just sitting down, and or lying down will probably be the most comfortable position. So let's just say that standing and walking because you're all crooked is painful. Well, then find the comfiest position. Trying to correct a shift by pushing your hips in the yucky standing position when symptoms start to grow in your butt, hamstring, calf, and leg, well, it's just more risky and, again, more painful. So find a comfy position, which is usually sitting, and all you're going to do is you're going to go back to a trunk twist. I like trunk twists. They work for lots of stuff. All right, so what you're going to do is you're going to sit, you're going to sit comfortably, come a little bit off the back of the chair so you have some room to just kind of move your trunk. And all you're going to do is you're going to twist your trunk to the right, twist your trunk to the left. Cool, and again, I don't care where your hands are. I don't care if you sit up tall or you don't. Find the comfiest position, and if you're not sure if it feels good or feels bad, you can do it again and or hold yourself in that position for a moment or so. See how it feels. By the way, if you have any symptoms in your butt and or your leg when you're sitting still, maybe sitting isn't fully pain-free, then just see as you hold yourself to the right and or to the left what happens to your leg symptoms. So twist to the left. Ask yourself, does it feel good or not? Yummy or yucky? Feels yummy, okay, maybe an option to help you out. And what happens to your leg symptoms? Same, better, worse. If it feels yummy and your leg symptoms reduce, that's awesome. Now you go to the other side. You're twisting the trunk to the right, twisting the trunk to the left. And you're just trying to make sure they feel safe. Then what I would do is I would pick the one that reduces any symptoms if you have symptoms in seated, and or the one that feels best. Just pick one. And either do a bunch of repetitions to that side, or hold it. So let's just say the right was most comfy. She would hold it, all right? So go ahead and hold the twist. And you're breathing and you're relaxing there and you're not forcing it, but you're just holding it, all right? And you might hold it for, say, 3 to 4 to maybe 5 30-second rounds. And then how do you know if it's something that's valuable? Well, you could stand up and see if you can walk to the bathroom with less pain and to see if you're less crooked. That's it, all right? So that's one easy way that is often much less painful and less threatening because it's done in generally a more comfy position, seated, and, well, you can't really screw it up. So at the end of the day, one thing you could do that's much less threatening than that shift correction, which nobody really likes, is trunk twists. Now let's just say you do that and it doesn't work and or they're both yucky and painful. Well, you could do something else. So I'm going to show you maybe a couple other ways here. All right, so the second option for you is something we're going to call all fours rocking or pushing back. And why I really like this is because, well, again, you have trouble when gravity is introduced into the situation. So probably when you're up, you're all crooked and doing this, right? And so let's take you into a gravity minimized position, if you will. Take gravity out of the picture, and oftentimes you'll be able to kind of move your spine in a much safer way like this. So all fours rocking back, hands, knees. That's why we call it all fours. And so what you're going to do is, now that gravity is sort of out of the picture, somewhat reduced, is you're going to find kind of a neutral position. Not that neutral position is necessary or good or bad for your back, but for the sake of this, let's just kind of pick a neutral position, all right? So a not neutral position would be fully rounded. I wouldn't recommend that, at least for this at the moment, and or fully arched. That's the extreme. All right, so find somewhere in the middle, just like that, all right? And what you're going to do is you're going to push back with your hands, all right? Push back with your hands such that you're trying to push your butt towards your heels. Now, let's watch what happens as she does it. So go ahead and push back. Perfect. So she did an awesome job there. She kept this neutral position throughout. Now, here's what will happen for most people who truly have these issues, is that as they push back, they'll round right there. See, it dumps. So go back on up. So start neutral again and show us again how it dumps. See how it starts to round right there. Again, not good nor bad, but most people might start to say, ouch, it kind of hurts. Keep it neutral the whole time while you're pushing back. Go ahead. And as soon as you notice it starts to want to round, stop. And just practice rocking forward, rocking back with that neutral position, seeing if you can get a little bit further with some practice and working some of the control in your belly. Now, I don't know if you can tell the difference, I'm talking to you, all right, is that because watching this, you won't be able to tell the difference. So you're going to have to kind of experience this for yourself. Instead of pushing back, pull back with your knees. Do you see what I mean?
Yeah.
Okay, what's the difference? Can you explain the difference?
I just feel like it puts more weight through here.
Okay, cool. All right, so again, experience this for yourself. But what a lot of people will do, and this is very nuanced, but it makes a big difference for a lot of people who have trouble doing this, is instead of kind of using your hips to pull back, all right, which causes you to shift a little bit more load and activate the muscles around your belly and your hip, which is a little bit sensitive maybe at the moment, focus on using your arms to push back, which essentially shuts these off or makes them work a little bit less. Keep the neutral position. Push, push, push. Perfect. And work that. And it's kind of like almost a form of like decompression and or traction. You're getting in a gravity minimized state that's more comfortable and less threatening. You're getting a little bit of this lengthening effect as you work that motion. And so what would I do? I'd do a few sets of say 10, 15, something like that. Work it for a little bit, take a sample or a bite out of it, and then see if you can improve your tolerance standing up, moving around. That's what you would do. All right, so that is the second way, all fours rocking back, kind of pushing back with your hands to maintain sort of that neutral position, but really just get yourself out of standing. And the other cool thing is that you're crooked when you stand, right? So maybe you're okay when you're sitting or in this position, but when you stand, you get all crooked. But if we go from this position, sorry, I'm gonna look at your butt.
Oh, great.
You can see that maybe she was crooked when she was standing, but now she's able to maintain this nice neutral position. Okay, so she's not all cattywampus because gravity is taken out of the picture. All right, so again, a nice way for you to kind of get that neutral position, sense what it feels like to kind of like live straight again, all right, while you perform some different motions with the spine. All right, so that's the second way. I'm going to show you the third way here in a second. Okay, so the third way that you can try to correct this is to be a little bit outside the box and or sort of unique or novel in your approach. Okay, so you can kind of reverse engineer this problem and take what you were trying to accomplish earlier with that painful side shift thing, right? So to correct this with a traditional kind of Mackenzie side glide approach, you would do what? Well, she would need to get her shoulders this way. So how would you do it? Her hips would have to go to the right, her shoulders would have to go to the left. Perfect. So that's what she would be doing. She'd be standing here, she was all crooked that way, and she'd be trying to get these hips underneath her, which is often, again, very painful. So, crooked yourself again. If you're like that, right? If you wanted to side bend your body that way, right, because that's what would correct you, a left side bend, instead of trying to jam your hips to the right, why not try to use this leg and do a bunch of that? A bunch of left side leg raises. See how it causes you to kind of kink to the left relatively, right? So go up and hold it, it causes a left kink. The same thing you're trying to accomplish when you push your hips in. Right, so if this is the pivot point, you could try jamming your hips like this and causing this C to the left, if you're tilted to the right. Or, if that's really yucky, you could work a left side leg raise, which again puts you in that side bend. Now here's the thing. Let's take this one step further. Rather than trying to correct you from above, is really what I'm saying, by moving this segment, now we're trying to correct you from below by moving the leg segment from below. But instead of now, let's think about position, trying to do it in standing, which is really yucky, let's do it lying down. All right, so she was like this. Bring yourself crooked again. All right, and we're trying to kind of put her back that way so that she looks more upright. So what we could do is I could say, hey, can you lay on your, do you know what we're going to do? We're going to do a side leg raise, but we're not going to do it in standing because standing's too yucky.
So lay on my right side.
Lay on your right side, very good. Good, so again, less gravity here, all right, involved. Now, if this is too yucky, because she's already kind of getting neutral and a little bit to the left where we want her, but maybe it's a little too yucky. If it is, you could always put a pillow or something under here, and it would kind of level things out. But let's just say you could tolerate this, all right? So remember, she was crooked to the right, so we need to bring it to the left, but this was really, ugh. Then we could lay her on her right side. Now she's kind of going neutral. And then, bend this, straighten this, right? Roll forward just a tad. Perfect. Now, can you just work this leg raise just like this? You can do it. Now, the fatal flaw will be that you'll want to pull this leg forward when you do it. Or you'll want to start doing weird stuff like that, right? If you like look at an exercise class and you're in there, there's like 20 men or women doing this stuff. They're all 1 and 2, and they're doing funky stuff, and they're just activating the front of their hips more. All right, so keep it in line, right, like that, and just work that plane. It's not a big movement. There's a little micro side bend. We're not so much going for the side bend, all right?
Yeah, you're pretty good.
We're not so much going for the side bend. I think you get the concept, but instead, we're trying to see if we can move the body in that direction that we want it to go from below here versus above there where we know it's feeling yucky. All right, now if that's a little bit yucky, one last little tip here, okay? Take your hand, put it right here, there's good, and that hand is gonna monitor because sometimes what happens is people do this and they say, ow, it's painful. And why is it painful? Because here's what's happening. As they do this, they start to bend here. Go ahead and do it. Do a bunch of them. So they start to kind of side bend. Yep, so she's getting a lot of kind of flex or wiggle at the base of the spine. But if you put your hand there, now give a little bit of a push downwards, just a little bit, not a lot. Okay. Now go ahead and straight, leg raise, and just focus on that. Perfect. So do you see now that she's stabilized in a loose sense, right? Monitoring how much she's kind of flexing side to side, and she's able to feel it, she's able to work it from below, and potentially reduce her symptoms by kind of just being a little bit creative. All right, so hopefully that was helpful. So 3 things. If you're standing on the wall, trying to do this, and you're just jamming into pain, it's not working, it's shooting stuff down the legs, then there's simpler ways to do this that can work just as well and don't cause you to cringe and or experience a flare-up or more pain. Number 1 would be you can try some type of yummy twist while you're seated. How does it feel when you get up and move then? Same, better, worse. The next thing you could do is, perfect, well-trained, very good, is you can work on some type of neutral position, pushing back just to when you feel the back is gonna kind of break, right? Not literally, by the way, all right? Just figuratively in the sense of kind of like round over and stop there and work it. It's a gravity minimized position, so all 4's pushing back. And the third way, very good again, is to work some type of side leg raise. The motion is not big here. If you notice that you're flexing at the spine, right, you can put your hand there just to monitor, keep everything in line. I would even say roll forward just a tab, kick your leg back, there you go, great. Okay, and you will feel it working, no doubt. Good. All right, so those are the 3 ways, all right? Let me know your thoughts below in the comments. Was this useful? Was this not useful? Also, be sure to hit the subscribe button as well as the bell for notifications when we go live every single week. At least we try to. And of course, if you have any questions, make sure you put them below, and we would love to help you out. Until next time, thanks so much for watching. Chat soon.